Today we are going to discuss about cholelithiasis. Cholelithiasis. See, what is cholelithiasis? Cholelithiasis is nothing but gallbladder stones. Okay, cholelithiasis means gallbladder stones. Why these gallbladder stones are occurring in the body? Okay, now I have to know why these gallbladder stones are occurring, but why I am studying about this. So, whenever I will draw one diagram, this is liver and this is gallbladder, this is duct and this is pancreas and two small intestine. See, the bile contain bile salts, pigments, cholesterol and also calcium carbonate. See, the bile contain bile salts, bile pigments, cholesterol and calcium carbonate. What happens here? In normal physiology, this bile will be secreted and it will be thrown into small intestine. But in our cholelithiasis, what happened? This bile, due to some reasons, remains there only. Due to some reason, this bile remains there only. So what happened? This levels will be increasing and they will be forming crystals. Okay, now till now what we understood, cholelithiasis means gallbladder stones. Okay, normal physiology what happening? The bile is there in the gallbladder and it should be secreted into the small intestine. Okay, normally it's happening. Now what happened? This bile is either obstructed here or something is abnormal here. So here stones are being formed. Okay, what is that abnormal thing which is making to form stones? Now we'll discuss. If now the factors why these stones are forming, I will tell the factors. Age, write along with me. Age, sex, geography and genetic, not autoimmune, hemolytic anemias and diet. Okay, and if you are taking any drugs and fertile woman. One more thing, see, whenever a person takes food, what happen here? From the small intestine a substance is released that is known as cholecystokinin. Okay, this cholecystokinin, what it does, it will go near the gallbladder and make it contract so that the bile is excreted more efficiently. Okay, cholecystokinin in normal physiology only, normal. After taking food, this small intestine releases cholecystokinin, which goes into the gallbladder and acts on its receptors and make it contract, and more efficiently the bile is excreted into the small intestine. Okay, though that is the thing there. Okay, now how age affects? Age, if more than 40 years, if the person is more than 40 years, what happen? This cholesterol is being introduced into the bile by the liver. Okay, as the age progresses, the amount of cholesterol which is sent to the gallbladder through bile is increasing. So after 40 years there might be this formation of stones. Okay, that is also good. Sex in females it is more than males. Why? Because see, in females there is estrogen. This estrogen, what it does is it will increase the secretion of cholesterol into the bile. Okay, did you get the point? So as it is increasing the secretion of cholesterol into the bile, what happen? Cholesterol will be increased in the bile, so it might precipitate and form cholesterol stones. Okay, male also okay, female also okay, we understood. Geography. In western countries, what is that? See, in western countries most of the people will take more fat rich food, and they will also take more calorie rich food. Okay, so what happened, this more fat rich food or calorie rich food will make this geography western people to more susceptible. Okay, okay, this one also geography also okay. Genetic factor, there is one enzyme called cholesterol 7 alpha hydroxylase. Okay, this 7 alpha cholesterol 7 alpha hydroxylase break down the cholesterol, but due to genetic susceptibility we have mutation in this enzyme. So what happened, cholesterol will be increased. Okay, this one also understood. Hemolytic anemia. See, whenever the hemoglobin is degraded there will be production of bilirubin, right? That bilirubin here, pigments there, right? What are the constituents of bile salts, bile pigments, cholesterol. Now this pigments, this bilirubin will be increased due to excessive damage of RBCs. So it might be reason of pigment stones. I will tell you when in the classification of stones, but till now understand the factors why these substances are being increased. Okay, now diet. If you take diet rich with fiber you will be less prone to cholesterol stones. Okay, that the thing, that is dietary, we all know it. And drugs like oral contraceptive pills, what they contain? Progesterone and estrogen, right? What this estrogen done in normal women, it is increasing the secretion into the cholesterol into the bile, right? The same thing here also, it does the same thing. And in fertile women the most important is there is increase in two hormones, that is progesterone and estrogen, right? This progesterone, what it does is this progesterone will go, and here it will decrease the contractions of the gallbladder. As it is decreasing the contraction of the gallbladder, what happened, the efficiency by which the bile is excreted into the small intestine will be decreases. That is called gallbladder stasis, nothing but decreased movements. Okay, we understood fertile women why is more prone, drugs why, age why, sex why, geography, everything we know about the why they are increasing. Okay, it's very good. Now we will understand one more thing. Okay, from the beginning I am telling this is the causes they will increase cholesterol or bilirubin, but I am not telling, okay, even though they are increased, why they are forming. Okay, I will tell that one now. See, there are in the bile there are two things, those are pro and inhibitory. Okay, the pro are mucin, non-mucin, glycoproteins. This mucin and non-mucin like glycoproteins, what they do, they are pro to formation of cholesterol stones, and inhibitory are apolipoprotein 1 and apolipoprotein 2. These are against the formation of stones. That means if there is a balance between this and this, there is no stone formation. But if there is no balance in this, if this is increased and this is decreased, there will be surely formation of stones, right? Okay, that is the point of pro and inhibitory materials. So okay, this one also okay, everything okay. But okay, even though they are increased, these are decreased, why the stones are forming? First, what happened? First, cholesterol increased. Okay, cholesterol increased. After cholesterol increased, balance balance between the pro and inhibitory, that is mucin and mucin like substance, glycoprotein and apolipoprotein are okay, disturbed, balance disturbed. So after balance disturbed, what happened? There is a nucleus formation. This cholesterol molecule will aggregate and form the nucleus, and it will eventually lead to the formation of stone. Here there is one more thing. If I told about cholecystokinin, right? That one, if cholecystokinin is also less, first cholesterol is increased, balance is disturbed, and stone is formed. And now it means this initially small stones. These stones are formed, but cholecystokinin also not releasing properly. Cholecystokinin is maintaining the stasis, right? Maintaining the contractions, right? So it is also not released properly. So what happened? This stone will be blocked in the gallbladder itself, or in any place in that pathway. I told, right? This is a liver, and this is a gallbladder, bile duct. This is going to pancreas, and then it is going to intestine. See, anywhere this can be obstructed. Here cholecystokinin also maintains a role. Okay, cholesterol stone is formed, it's okay, I now understood everything. Then what is next? From that time we are thinking stones are formed. Is only cholesterol stones only formed? No cholesterol stones only formed. There might be formation of pigment stones, that is bile pigment stones, and then calcium carbonate stones. Not only cholesterol, there might be bile pigment stones also, because it constituent the constituent there is, right, bile pigments also there in the constituents of the bile. So calcium carbonate stones also may occur. Okay, now here I told this balance is disturbed, right? So I will tell one more thing here. Bile plus lecithin plus cholesterol. See, if these are together, the cholesterol cannot be forming the molecule. That means like mass, like it can't form. But whenever this is broken, why it will break? See, think this is a taxi, bile like a taxi. We have two taxis, and here also cholesterol molecules, so two cholesterol molecules. Okay, but here now due to we are getting hypercholesterolemia, right? So due to hypercholesterolemia, what we are happening, this cholesterol increased to 4. These two are getting the taxi, then the remaining two, where they will go? They will go this pathway and form the stones. That is the main mechanism. And pigment stones, okay, I told how cholesterol is accumulating and how cholesterol stone is forming. Then why bile pigment stones are forming? See, while the bile should be excreted, right? If the bile is not excreted, why? Ascaris. This Ascaris lumbricoides, if it is infecting our body, it might block this passage and lead to accumulation of bile inside only. So it might lead to bile pigment stones. And one more thing, I told that initially RBC are being destroyed so that more pigments are produced, that one. So due to that also it might happen. What is that? Hemolytic anemia. Okay, this both causes the bile pigment stones. Okay, this is also good. From the starting I'm telling there are different types of stones, and I told also, but I will give more description about them. Okay, now there are pure stones, mixed stones, and combined stones. Pure stones are purely made up of cholesterol, pigments, bile pigments, and calcium carbonate. These are purely made up of pure substances. What predominantly cholesterol. Total the substance of the stone is the cholesterol. If it is pigment, predominantly it's pigment stone. These are different, not single. Okay, in pure we are having cholesterol stones, pigment stones, calcium carbonate stones. Okay, that one also nice. Then in mixed stones, these all will be mixed. That's it. Easy, right? And in combined stones, these substances only will be there, but the type of arrangement is different. The type of arrangement is different. Mm. Okay, I will explain each and every one. In the cholesterol stones, what is the color of fat? It's yellow, right? So it is yellow color, and it is single large. It is soft. We know soft, yellow, soft, single, large, solitary. They are single stones, and coming to pigment stones, they are multiple stones. What is their color? Their color is jet black. They appear like mulberry like appearance. Mulberry like appearance will be there. They are jet black in color. Multiple stones means what? Here the cholesterol stones is single stone. Here there will be multiple stones. Okay, and these are fasciated. What is the meaning of fasciated? That means they have a side. Means we can determine the side. Means we can observe like some side is there to it. That one fasciated. Okay, now we understood cholesterol stones. And one more, in the cholesterol stones, if you cut the cholesterol stone horizontally, you can see some radiating crystalline appearance. Okay, some, if you cut this, you can see that radiating appearance from the center. On CS, radiating crystal appearance, you can see that. Okay, that one finished. If you cut this pigment stones, you will see soft black only. They will not have any crystal like structures. They will be soft and black. That's it. And calcium carbonate stones, this one also multiple stones, and they are hard. See, wherever the calcium comes, even in the renal stones, wherever the calcium comes, it will be surely hard. It will not be soft. Okay, they are multiple and hard. Okay, calcium stones also finished. Calcium carbonate stones. Now, what are mixed type of stones? In mixed type of stones, this all will be combined. I told, right? These all stones will be combined in the stone itself, or there are, see, suppose this is what, pigment stone, and this is calcium carbonate stone, and this is cholesterol stone, or they might be combined like this, half irregularly. They might be combined. So these are multiple we can see alternate dark pigment and light and pale pigmental area. See why we are seeing the dark pigmental area? Because of this bile salts. And why we are seeing the pale? Cholesterol and this calcium carbonate stones might give the pale appearance. Okay, this one also finished. Combined stones, these are large single solitary stones. In this there are two types. This one, see, I drew something like granular outside and only single circular like inside, right? So this is called, this this center is made up of only one substance, and this granular substance is made up by two or three substances, any other substance. And this is called hmm, pure gallstone nucleus. Means that is only one substance, with it is made up of only one substance with heterogeneous gall shell is made up of many things, so it is heterogeneous. And here the center nucleus is made up of different things. So here hetero, okay, not you have to write shell first, which is pure. You have to write that one, pure gall shell. The shell is pure and with heterogeneous nucleus. Okay, here we discussed about everything. And now you might ask, which type of stones are most common? This mixed type of stones are 80%, this combined stones are 10% common, 80% common, and this might be 10% common. Now here what are more common? Mixed type of gallstones might be common. Why? See, if there is increase in cholesterol, and see, due to dietary changes, the patient might also land up in all the metabolic disorders. But here only single stones we are discussing. Here also combined stones also very less prominent. But here mixed stones means, while the disease occurring along with it many things will happen, right? So mixed will be more prominent. And now we'll discuss, see, if some person have gallstone, how he will come to the hospital, with what complaints he will come to the hospital. And those are our points which we can catch in exam and identify. And then I will tell what are the complications of obstructions of the stone. See, it might lead to right hypochondrium region pain radiating to right shoulder. See, there might be right hypochondrium region pain which is radiating to shoulder. Why? This is the place where the bladder is present. So it might radiate to right arm. Why it is radiating to right arm? Because we can take dermatomal theory. The same dermatomes will have take the pain sensation, right? Okay, that one dermatomal theory we can take. Many other theories are there, but right hypochondrium we can know. But pain radiating to shoulder we can take as dermatomal theory for side. And we also have altered liver function tests. And one more very important, what we saw in the factors, cholesterol, obese patients, right? More increase in cholesterol. So we can see in obese patients more. Okay, these might be the most common complaints: obese patients, altered LFT, right hypochondrium region pain, which is radiating to shoulder, might be the complaints of the patient. And now, what are the complications? Again, we'll draw our liver, and this is the gallbladder, this is the things. Okay, from here it is coming this side. It is coming to pancreas, and from here it is coming to small intestine. Okay, if the formed stone is obstructing here, it might lead to cholecystitis. We'll discuss about very keenly about cholecystitis in another video, but I will tell here only what it is. It is obstructing here. So what happened? Inflammatory mediators come and inflame the area, this neck area. So it might lead to cholecystitis, inflammation in the gallbladder. Okay, that one nice. Then if this stone comes somewhat downward, it might make obstructive jaundice. Okay, as it is obstructing the bile, it might lead in obstructive jaundice. Okay, obstructive jaundice also. Okay, we understood. If it is what making obstruction in the pancreatic region, it might lead to pancreatitis. It might cause inflammation in the pancreas. So wherever it goes, it creates inflammation there. Okay, but here in the bile duct region, it might lead to obstructive jaundice. Okay, if this stone all the way came to the ileum region, what will happen? It will cause gallstone ileus. See, it is obstructing the intestine. It might cause that. Sometimes it might also cause fistula. What is fistula? It might attach this bile duct with the pancreas or the surrounding organs, or rarely with the skin. That fistula is not seen most of the cases, but these are the things which might be surely seen: cholecystitis, obstructive jaundice, gallstones, pancreatitis, and gallstone ileus. And one more, gallbladder cancer is very rare to see. Okay, gallbladder cancer might occur, but it is very rare to see. And one more thing, mucocele. What is mucocele? Here it is obstructing, right, in the neck. The cells will secrete mucus. If the emptying is proper, it's okay. They will leave in the secretions outside. But here the secretions are not living outside. So what happened? This gallbladder is bulge with what? With mucus. So what it causes? Mucocele. Okay, I try to cover everything which is important for the exam purpose. So I hope you understood.